Hey friends, really exciting meeting I had today with a guy named Dr. Josh Rowell. There are dentists, and then there are dentists, and then there are biological dentists. Life, biological dentists. Thanks for joining me. Really,
no, thank you.
Really appreciate it. Number one, my smile, my fixed tooth in the front. I went to a couple of dentists 4 or 5 months ago, and they said, nope, that's shot. You're too near the nerve. You know, you have to have root canal, and you gotta. We'll put posts in. My friend down the road charge $5,000 per post. Come back here, I'll do some. I think I'm 75 years old. Probably only need these chompers, you know, not so long. My wife goes to your partner, Dr. Kozlow. I tried to get in to Dr. Kozlow, and as God would have it, Dr. Kozlow was busy. And the girl said, but we have a real good, you know, biological dentist here. Welcome to Dr. Josh Rowell. It was amazing for you to come back. It's so nice. Everybody there. I loved your office. But you came back in 5 minutes and said, it's no big deal, Doug, good news. I can give you, I've been flossing and eating carrots again and doing everything with this new front tooth, so thank you for that. Would you explain, I use those two words, biological dentistry. Would you explain to this office how you're different? You graduate from dental school. Yeah. You learned about amalgam. You learned to do root canals. Where did you go so right?
Yeah. Well, you know, it's one of those things where dental school, it gives you a foundation of what dentistry is, but there's a whole nother level. And I got lucky to get in with Dr. Kozlow, and you know, there's a lot to learn once you leave dental school. There's a lot to learn, and we're part of a group called the IAOMT, and that is an organization where we are taught how to be biologic dentists, how to be holistic dentists, and I know we've kind of talked about this. Those are two terms that are almost used interchangeably, but when we're talking biologic dentistry, we're talking what material we're using that works well for you. And we're talking about doing what's best for you whole body wise when we're talking holistic wise. We're looking at systemic problems, how they affect the mouth, how the mouth affects these systemic problems.
Holistic, whole. This is bad. It's going to impact this and this and this. It's so amazing. And folks, dentists are good people. Twice my IQ, I've always said. But they're doing procedures that are 50, 60, 70 years old. And that's what medical schools are teaching them, dental schools are teaching. Just like your doctor handing out an antibiotic and a splint to everything that comes in. Some dentists, biological dentists, have figured out there's a simple tube of blood that they can take to find out if they have to take all this neurotoxic mercury out of these amalgams. Well, doctor, what do you put in? What do you put in?
Yeah, so what we're doing is we are putting in materials that work well for that patient. Like you said, the tube of blood that you're talking about, we do what's called biocompatibility testing. So essentially what we do is we take their blood and we get the results. This is a big booklet of every dental material you can imagine, from highly reactive to least reactive. And so what we can do is we can take all those least reactive products, those materials,
to their thumbprint.
To their thumbprint. That's right, exactly.
So highly reactive, stay away from those.
Stay away from that.
But these were tiny, so we'll use this product.
That's right.
Oh, genius.
That's right, exactly. So everything is specialized to their genetics, their environmental factors that they've had throughout their life, that's made them who they are.
Personal question, are you frightened when you begin to pull out this noxious metal amalgam?
We are. That's so. Obviously, you know, when we talk about amalgams, we call them mercury fillings because that's what they are. They're an amalgamation of a bunch of metals, but mercury is one of the top ones there, okay? So one of the two most dangerous days of that mercury filling is the placement and the removal. And sometimes the removal is even worse. So what we do is we go through something called SMART certification, Safe Mercury Amalgam Removal Technique, okay? We basically treat that mercury removal like a hazmat procedure. We have the patient on supplemental oxygen, big mercury vacuum at the base of their mouth. They're draped up. We have special masks on. The goal is to keep everybody in that room safe. And one of the main things we'll do is I take a really small dental drill
Yeah.
And we just trace around the outside of that little mercury filling and pop it out. So one of the worst things you can do is grind that thing out. Then we release all that mercury at one time. So
you know what, Dr. Rowell, I was driving home one day when the TV was on, helicopters circling. I said, no, not another school shooting. It was a building. And I just almost fell apart. There can't be another school shooting. Well, as it turns out, this is 20 years ago or so. 2 little boys were playing with a thermometer in the nurse's office. Broke the thermometer. In comes hazmat. There go helicopters and police lined off the school because it's okay to drill a hole into their jaw and put the mercury there. It's not okay if a thermometer breaks. Can I ask, how does someone get through dental training and then say, do dentists not get sick with all of the mercury they're exposed to?
Well, that's a great question. You know, there's a lot of health risks that come with being a dentist.
Yeah.
And I think a lot of that is associated with the materials that they're using throughout their whole career, starting in dental school. You know, in dental school, we were taught to have to use mercury fillings, and we had to have a certain number to graduate. And it wasn't until I had my own health issues coming on around that same time. Like you said, Doug, ask when the symptoms started.
Right. Yeah.
So where I knew there had to be something more. There had to be a better way of doing it.
Do you learn, and I'm look, do you learn that there's some dangers associated with this? Is it neurotoxic? Mercury is a known neurotoxin.
Yes, it is a neurotoxin. And so, yes, we do learn that, okay, in a certain sense. But we really get it. I really started to understand the dangers. That's how I got out of dental school and farther into my career. You know, one thing that they'd always say is when that mercury filling is cured and bound, that it's good.
Inert.
Yeah, it's inert. It's inert. You know, there are videos and studies that show the smoking tooth of. Here's the thing: mercury has such a low boiling point that eating and drinking hot foods and liquids, clenching and grinding really hard, and getting that frictional heat, we can actually off-gas that mercury filling. And a lot of times, you know, we worry about the ingestion of the mercury, but one of the big dangers with mercury is the off-gassing systemic problems as we breathe in those mercury vapors, and it's deposited to these end organs.
Before I get into root canals, you said something kind of magical there. You and I did a show together earlier talking about ask the patient the right question, right? So you have a patient who's polysymptomatic, everything, you know, got blepharospasms, got sore knees, can't get out of bed in the morning, got gout. And you've been to doctors and they've tried medications. Folks, the last thing people think, wow, was that 2 years ago I had that root canal? Could that have gone, could there be bacteria in my bone now? Could that be leaching in my circulatory stream? Could that be causing these kidney? The last thing you and I would think, the absolute last your physician would think. The first, Dr. Rowell and Dr. Kozlow would think. You're just different kind of guys. Have you had testimonials like I used to get tremendous, and still do, with fungal disease and so forth? Have you had testimonials? Have you seen patients that you said, look, there's only 3 of them, let's get those taken out, and the rubber dam and the mass and everything, who came back in a month and said, holy cow, I need to hug you, you know, that went through a dramatic health change because of getting a root canal fixed or mercury out?
Yeah, absolutely. I mean, and to be honest, more than I can remember and count. It's amazing what getting rid of that the root cause of that toxin can do. Now, with that being said, I can never say that taking one of those mercury fillings out is going to do anything for them systemically. But what I can say is this is a toxic material and we can take it out safely, remove this source, and it's amazing what the body can do when it starts to go through the healing process.
The important thing is you and the patient know in your hearts there was a cause and effect relationship. Right. It's not going to dinky, I got those 3 out, and all of a sudden my eyes can see again, you know, and there's a host of health problems that would ensue if you're being poisoned with a known neurotoxin, mercury or other amalgam. Now, root. Root canals. I'll never forget, many years ago, I had a root canal. didn't know much about root canals or why I should or shouldn't. It's since been fixed, but tell people about root canals and what might go wrong.
Right. So in our office, we do not advocate hard for root canals. Okay, and the reason being is, so let's talk about this. Let's talk about really quick why you might need that root canal. All right. So sometimes we'll have a really big cavity, a really big fracture,
right.
Something that has gotten down to that inner part of the tooth, what we call the pulp, and that pulp is comprised of a bunch of organic tissue, whether it be nerves, blood vessels, whatever it is. Right. It is not hard tooth structure. It is organic tissue. And when that organic tissue dies off, we now have necrotic tissue left in the body. So when that happens, we got to do one of two things. You either have to take that necrotic tissue out, okay, which is called a root canal, or we talk about taking that tooth out. All right, so we got to get rid of the source of the infection. Now, the problem that a biologic dentist has with a root canal, and they have their own uses and things like that, but they do a good job of getting that main canal out of that tissue. Or the tissue out of the main canal. But the problem is there are a ton of little accessory canals throughout that tooth that they just can't reach. So there's always some tissue that's left over, and what will happen is sometimes bacteria can get in there, they can feed on that dead necrotic tissue that's left over and create secondary infections around the tooth. Now, here's the problem. You've had the nerve taken out of the tooth, so say that the tooth starts to get reinfected. You don't know. There's no pain there anymore. So a lot of times we can have these hidden infections that are sitting in the mouth for years, and we can have chronic sinus infections that are kicking up, and the patient just doesn't understand why. Yep. Then we come in and we take a 3D scan and we can see, oh, this is a massive infection around this tooth that's contributing to all these other problems.
Would you then, your office, not a dental office, but would you then put the patient on an antibiotic or two?
Right. So ideally, no. Okay. I mean, yes, we can. Sometimes it needs to. But our goal is to talk about getting that tooth out. The analogy is you have a huge splinter in your arm. Okay. It's really infected. I say, well, here's an antibiotic. Good luck.
Leave it in.
Yeah, leave it in. Right. Now, you get the splinter out. Okay. You get rid of the source of the infection, and then, if need be, we can talk about something else. But really, what we like to use in this situation are things like ozone, a natural pathogen killers. Okay. Yep. So you remove the source of the infection, the dead necrotic tissue, the dead necrotic tooth, and then the body will start healing itself up really good. We scrape all that dead necrotic tissue out of there good and flush it with ozone, and the body heals up really, really nice.
You know, I'm looking at this mechanically, and I'm thinking there's much less money in doing it this way. There's bigger money. I know the codes, dental codes. There's big money in going through a root canal or two procedure and putting fillings in. It's quicker, but I'm wondering why in the world someone would graduate, from dental school and then put the brakes on instead of the accelerator. Have you ever retrospectively looked at your life and said, boy, I could be out, making $1 million a year filling, but you didn't do that? Would you agree with me that 97% of dentists would say, that's totally unnecessary, mercury's safe?
I think there are a lot of them out there. One thing that I look at when we're talking about holistic dentistry is the word conservative. Okay, we want to be conservative. Yeah. And that starts from an early age, where these children come in and they have these cavities, and they were just never taught how to remineralize, how to do these other things to keep this disease process from happening.
What starts these cavities? Yeah. I see them in 6-month-old or 6-year-olds. When teeth start coming in, my friend once told me a dentist sees degeneration before a pediatrician does. So you guys are seeing this when the teeth are. Is it sugar? We're told sugar is so bad. Tell me. Yeah,
wonderful question here. So here's the thing. Obviously, there can be mineral deficiencies. There can be some genetic deficiencies. There can be reasons why the teeth just don't grow correctly and develop correctly. That's one thing. But the majority of it is not understanding the remineralization and demineralization process of a tooth. So here's the thing. Anytime adult or child. You know, we can look at it in both ways here. Anytime we ingest anything with a carbohydrate, and you're going to be amazed at what has a carbohydrate in it. There's some of those healthy snacks you're like, oh, this is great stuff, and you look, you're like, oh,
carbs.
Yeah, it's carbs. It's carbs. Bacteria in your mouth will take that carbohydrate and convert it to acid. Okay, we create an acidic environment in the mouth, and every time you eat or drink that carbohydrate, your mouth is in an acidic environment for about the next hour. Okay,
wouldn't that acid begin to break down?
That's right. That's
all
right.
this amalgam and
exactly breaking down all the old amalgam, all the old fillings,
Yep.
and the teeth themselves, and minerals are getting brought out, and they're slowly getting brought out to the point of the tooth getting soft in an area, and then they keep getting brought out to the point where the tooth has a little hole there, and the hole gets bigger. This is how the cavity process starts.
From a biological dentist standpoint, there are diets out there, everything, you know, from the keto diet and even more severe, the carnivore diet. What do you guys like? You know, what do you?
Yeah. Actually, I prefer something like a keto diet. You know, that's great. I love that, and I like that in conjunction with intermittent fasting.
Yeah.
Okay, because like I said, every time they eat or drink a carbohydrate, there is about an hour of demineralization and acidic. Think about this: if you're having, especially these kids, having a snack every couple hours, they constantly stay in this demineralized environment, this acidic environment that's bringing minerals out of the teeth. And you know, especially with some of the snacks that these kids have, that snack you'll look at an hour later and it's still stuck on the top of their teeth. Like, when did you eat that?
Your poor kids. All I can say is I know you have a couple of beautiful
That's
kids.
right.
Those poor kids, I can't imagine. I know from your office you kind of like a vitamin D3, vitamin K2. Are there supplements kind of your go-to in the office?
Yeah. So you know, let's first talk about the remineralization supplements that we use here. Okay, so we are really big on high pH mouthwashes. Okay, neutralizing the environment. So like I said, these are really good for right after you eat or drink. Say, hey, I don't want to scrub, because you really don't want to brush your teeth for about 30 minutes to an hour after after you eat, because the teeth are now soft because it's an acidic environment. So you can take some of that high pH mouthwash, switch it around a little bit.
High pH alkaline?
Yes, that's right. That's right. Yeah. You don't, not acidic.
Right.
Yeah, we're going the opposite direction.
Yep.
Yes. So we can take that down and at least kind of get rid of some of that. Okay. The other thing is nanohydroxyapatite. Okay. These are the hydroxyapatites are the minerals that make up the teeth. Our goal is to put those minerals back into the teeth, to create an environment where that is abundant. So we're transitioning the teeth from going to this demineralizing environment to this remineralizing environment. So, you know, a lot of times.
Do you have those in your office?
Yes.
Every patient needs.
Yes, 100%, and exactly. And you know, a lot of dentists and offices, and we'll use fluoride. We are a fluoride-free office. Okay, we want to remineralize with natural products, calcium-based remineralizing products, hydroxyapatite, things like that.
Wow. Wow. Just loaded with information. I'm sitting here after, 16, 17 minutes going, it's like I went out and ran 2 miles. It's really, really good information. Thank you for your heart. I've been to your office. Thank you for that incredible office. Folks, if you want more information on what Dr. Rowell does or talk to them, we put up their telephone number. Do call. The last person in the world you would suspect of causing symptoms, because they don't want to, is a doctor or a dentist. Very often, the therapies they use today that are traditional and accepted, and insurance loves them, are the ones that may end up snapping on you at some time. Thank God there are biological dentists who understand that. Thank you, Dr.
No, thank you, Doug. Really appreciate you.